Welcome to our third video about sexual transmitted diseases. As you know better, this is a big topic, so we'll try to capture it gradually so that you can get some short videos that you can watch with interest. Modrix is my name. At this time, we are going now to look at the common sexual transmitted disease syndromes. Common sexual transmitted disease syndromes. And we have 10 syndromes that are common. And remember, in sexual transmitted disease, as we are yet to see, we manage based on these syndromes. So we have the following syndromes. The first one is urethral discharge syndrome, genital ulcer disease, and this can be both in male and female. There is vaginal discharge. There is pelvic inflammatory disease. There is painful scrotal swelling. There is another syndrome which is inguinal swelling and adenopathy. Then we talk about ophthalmia neonatorium. Then talk about Bartholin abscess, balanitis, which is the inflammation of the penis, then genital warts. These are the 10 syndromes that we shall talk about in details, and we manage syndromically in sexual transmitted diseases. So what is a syndrome, or what is syndromic approach? So syndromic approach is a dynamic approach that focuses on a set of disorders for effective management of sexual transmitted diseases. So syndromic approach, we are saying, is an approach that focuses on set disorders for effective management. We shall, based on that, all urethral discharge syndrome have a certain specific way to manage them, even not first looking for any investigation. And once you manage clients, basing on the symptoms or the group of signs and symptoms they possess, then we say we are managing them syndromically, as we shall see how to manage these conditions syndromically. So an STI syndrome, we are saying it's a combination of symptoms and signs. So a syndrome is a combination of symptoms and signs a patient complains of, which can be transmitted from one partner to another through any sexual intercourse or any sexual contact, and it can be treated with a combination therapy. So when you talk about STI syndrome, we are looking at a combination of symptoms and signs. This client will come complaining of, and these are going to be transmitted from one partner to another through sexual intercourse. And if we are to manage this client, we manage using a combination of therapy. So a syndrome is a group of signs and symptoms. And when I say we manage syndromically, it means that we have a group of signs and symptoms, and once they lie in a certain area, we have drugs set to manage such a client. What are the advantages of syndromic approach? One, identifies and treats by signs and symptoms. And this is the key one. You identify and treat based on the signs and symptoms. That's the first advantage of syndromic approach. So you want to waste the time waiting to get investigation, get results from the lab. Once someone possesses certain signs and symptoms, you start treating, and that's an advantage. Next advantage of syndromic approach is symptoms easily recognized clinically, that it is very easy to identify this syndrome. For example, how painful scrotal swelling, you will see, and the client will verbalize that there's pain. Then how do you manage that? Immediately you start treatment. The next advantage of syndromic approach is treatment is given for majority of organisms. You will give treatment and can eradicate a number of microorganisms. Then another advantage is simple and cost effective. And why we say that is simple and cost effective is that you don't need to first do investigation and you don't need to struggle because symptoms are easily identified. Next, you are saying valid, feasible, and immediate. The approach is well known, authorized, it is works immediately, and it is feasible. Lastly, we are talking about an advantage of syndromic approach is that allows all clinicians to provide excellent care without referring. Clinicians are able to provide excellent care without referring. So we are saying most people or most clinicians would have referred these clients, but because of syndromic approach, now they are able to choose the client and they're able to protect the community. In busy clinics, syndromic approach is the best. This is another advantage in that it makes sure that everyone receives the drug because it is quicker. It provides the best care possible in the most effective manner. Lastly, but not the least, you are saying used routinely by all STI clinicians will reduce waiting time. Imagine those long queues in the hospital. Now you are going to do investigation, rotate here and there. Now there is syndromic approach, which solves that, reduces the waiting time. Once a client has been known with certain symptoms, treatment starts, hence reducing on waiting time and even relieving congestion in the hospital. Lastly, we are saying we'll simplify procedure and patient flow within the clinic, therefore reducing environmental stress. People will just come for a short time, they have already gotten all that they want and the right medication, right diagnosis, and hence they will not be stressed because of overstaying in the hospital. And that's what we are saying, therefore reducing environmental stress. So those are the advantages of syndromic approach. So next time we meet, we are going to talk about in details how we manage these clients syndromically. Thank you for listening. Let's meet in our last topics as we finish the sexually transmitted diseases. Thank you and God bless.